Good evening, ladies and gentlemen. It's a pleasure to welcome you to the Mackenzie Health's Community Consultation for Future Hospital Development. As Dave Barrow, the Mayor of Richmond Hill, and also a member of the Mackenzie Board of Directors, it's a pleasure to serve as Master of Ceremonies tonight and moderator for the question period. So thank you very much for attending. As we know, Mackenzie Health Richmond Hill is a very important part of our community, and we are here to tell you about many plans in the works. And I'll introduce the gentlemen that are here with us. They will be speaking later on, just in the order that as I see them. John Mills, the Vice Chair of the Board of Directors, Mackenzie Health. Dr. Verditis, local physician, and a person who forgot November is over, but however. And Altaf Stationwala, the President CEO, Dr. Peter Strohs, and our Member of Parliament for Ontario, Mr. Reza Maridi. So welcome. So as we move forward, we have presentations and as I said, a number of speakers that will be bringing us up to date today. I also want to introduce members of council that have joined us this evening, because we all feel that Mackenzie Health Richmond Hill is a very important part of our community. As Regional Local Councillor Deputy Mayor Vito Spadafora. Thank you, Vito. Regional Local Councillor Brenda Hogg, Councillors Lynn Foster and Nick Papa have joined us. So thank you. Thank you for helping join us. Also, Fraser Nelson, the Chairman/President of Mackenzie Health Foundation. Just Chair. And I don't know if Nancy Cutler's in the room, but the President of the Volunteer Association that greeted us as we came in. To begin, I'd like to introduce to you a very strong supporter of our hospital who has proven a very effective advocate for the quality of healthcare services in our community, and that is our MPP, Reza Maridi. Reza, you want to come forward?
Thank you very much, Dave, and ladies and gentlemen. It's a real pleasure to be this evening at this event. Anytime when I receive invitation to go to to Mackenzie Health Richmond Hill, still it will take some time to learn the new language. Mackenzie Health Richmond Hill. It gives me a great pleasure, and every time I go there, I see progress, and that is what counts. We are making a very good progress in the Mackenzie Health Richmond Hill, as well as Mackenzie Health Vaughan. As you all know, our government has committed for building a new hospital in Vaughan, which will be the second campus of Mackenzie Health, which will be called Mackenzie Health Vaughan. And this evening we'll be hearing more from Altaf about this project. Healthcare is very important to every individual Canadians and Ontarians, and of course people of Southwest York region. And for that matter, our government has committed investing significantly in improving healthcare sector in our province. I'm sure you all know that in the past 9 years we have increased the funding for healthcare sectors, particularly when it comes to hospitals. We have increased the operating budgets for hospitals by 54%, and we have hired 13,000 more nurses and 3,000 more doctors. Still, there are lots of work needs to be done. Our healthcare system, in my view, is the jewel in the crown of this country. When you talk to people from overseas or newcomers to Canada, and when you tell them that, you know, if you are ill, you just go into a clinic called walk-in clinic, or you can go to hospital at any time, any moment without paying a single cent. As many people can't believe this, but we know that it's reality, it's the fact of life, it's a part of our culture, it's a part of our heritage, and that's why we are, all of us, very keen in keeping this heritage, in keeping this culture, improving this culture, and also improving the services which our healthcare sector, including hospitals, offer to individual Canadians and Ontarians. With that, I thank the board members of the hospital, the foundation board, the volunteers board, and every member of this community who helped by some means for our hospital here and also the next one in Vaughan to grow. So thank you so much. It's a great pleasure to be here, and I look forward to hearing the plan from Mr. Altaf Station Vaughan. Thank you again.
Oh, here we are. I just want to introduce, and I'm sorry, Jen? Linda Ball. Linda Ball. We'll be doing, obviously, the sign language today for those that will help understand this process tonight. I want to thank you, Reza, very much for your support and passion for our hospital and the Richmond Hill, Mackenzie Vaughan hospitals as we move forward, and take this opportunity to ask you for your continuing support as we move through this process. It is now my pleasure to welcome John Mills, the Vice Chair of the Board of Directors for Mackenzie Health, to begin this evening's presentation. John?
Thank you very much, Mayor Barrow, and good evening, ladies and gentlemen. First of all, I want to, on behalf of the board, the staff, the physicians, the volunteers, the foundation from Mackenzie Health, I want to thank you all for taking the time to come here this evening so that we can share with you some of the progress that we've made in terms of healthcare in the region and some of our plans, our future plans for significantly expanding and updating and enhancing the healthcare services for our community. Once we've gone through the update, we will have a question and answer period, and I look forward to receiving your thoughts, questions, and suggestions on our proposed plans. Mackenzie Health is a new regional health care provider that was launched in June of this year. Our vision is to provide the best possible, i.e. a world-class healthcare experience for our patients, their families, and our community. Mackenzie Health will provide that care through a unique two-hospital model of care, which will include Mackenzie Richmond Hill Hospital, as well as the future Mackenzie Vaughan Hospital. To ensure that we provide the most efficient use of taxpayers' dollars, Mackenzie Health will have a single governance structure and a single administration overseeing both hospitals as well as a network of community service locations. I am privileged and have been for the last 9 years to be part of the board of directors of originally York Central and now Mackenzie Health, and have had the opportunity to contribute to this very important project, which is, in my opinion, essential to the expansion and enhancement of healthcare services in Southwest York region. As you may know, board members are volunteers who come from many different backgrounds with many different sets of skills. The board plays a crucial role in providing the strong governance and oversight to senior management and the operation of Mackenzie Health, so we can offer a world-class patient care experience. This is a big responsibility and one that we take on very seriously. Under the Public Hospitals Act and Corporations Act, the board has a legal and management accountability to the Ministry of Health and Long-Term Care for Mackenzie Richmond Hill Hospital, as well as the future Mackenzie Vaughan Hospital. The board also oversees the development of an annual hospital services accountability agreement with our local LHIN. This agreement details the services we provide to the community with clear and well-defined services and budget parameters. Mackenzie Health Foundation is responsible for local fundraising in both Vaughan and Richmond Hill communities, and will welcome donations which can be directed to support either hospital or to the organization as a whole. I might note this funding is absolutely essential to provide some necessary equipment like MRIs needed to create that world-class health experience. The Volunteer Association of Mackenzie Health comprises some 800 people. They also enjoy broad support from both Vaughan and Richmond Hill communities, with members ranging in age from 16 on to unmentionable numbers. They also have been they generously donate their time to raise funds and service our patients and our community. In addition, as already been noted, Mackenzie Health enjoys strong municipal, regional, and provincial funding support and has established over the past number of years a strong financial foundation upon which we can grow the healthcare services to meet the current and future demands of our community. Our development project for the Mackenzie Vaughan Hospital enjoys widespread support in many members of our community, including our elected officials, some of which, as you have already noted, are here this evening. Our vision and commitment to our community is to create a world-class health experience. This means the very best patient care experience provided by high-quality, safe, and accessible care. That also means growing strategically by ensuring that we provide the right service with the right partners delivered by the top-notch healthcare team. It also means providing that care in a financially responsible manner to ensure that we are making the most efficient use of our resources. In addition to Mackenzie Richmond Hill and the future Mackenzie Vaughan Hospital, Mackenzie Health also offers a wide variety of healthcare clinic services at 2 locations in Vaughan, 2 in Richmond Hill, and 1 in Barrie. Among many vital important services provided at these locations are dialysis, mental health, diabetes education, preschool autism, and brain injury services. Together, they form a valuable network of healthcare services in our community. The close and unique proximity of Mackenzie Richmond Hill and Mackenzie Vaughan hospitals will enable Mackenzie Health to take advantage of their combined patient volumes to deliver a new and exciting caliber of care to the people of our community. It is now my pleasure to share a short video with you which speaks to the exciting new major regional healthcare provider known as Mackenzie Health. Thank you.
as you can see, it's a change, but it's one that we're looking forward to as healthcare grows and becomes, as John said, a world-class system in Southwest York Region and Vaughan and Richmond Hill. It's now my pleasure to introduce Mr. Altaf Steshawala, President and CEO of Mackenzie Health, to continue the presentation.
So thank you. It's a pleasure to be here. Just before I get into my presentation, when we showed that video end of June as part of our brand launch to our staff, we had an auditorium of probably about 400 or 500 people that heard that story and that vision, and I can tell you the excitement was palpable. It was a very important milestone for our organization because our staff every day are struggling with the demands and the growth, and clearly what they see in this vision is an ability to meet growing demands for a growing community that needs more healthcare. So a tremendous level of excitement. So planning for the future, healthcare in our community, and I'm going to give you a little bit about what the future has in store for Mackenzie Health, but as much as we're focused on the future, we have a hospital to run day to day, and we have improvements to make every day, and we know that if we don't build a solid foundation of service delivery, no matter what we grow as it relates to the Vaughan Hospital will not be as good and as effective as it could be from a patient care perspective. So what I want to focus on first is really raising the bar and being prepared for expansion. And as an organization, we do focus a significant effort around quality of care and quality of service. In fact, the board provides tremendous oversight at that level, and every year we submit what is called a quality improvement plan to government. So this is a plan that identifies a number of initiatives in areas that we can do better on. So whether it's looking at patient falls or infection rates, these are things that, as an organization, we benchmark ourselves against organizations within Ontario, across the country, in fact, and try to put forward a plan that ultimately gets approved by the board and submitted to government. And if anybody's interested, those quality improvement plans for all hospitals are posted on websites, and you can get a sense of some of the things that are going on and the focus that we have at Mackenzie Health. Part of that quality improvement plan is three main priorities that we pick every year that we feel are important that we need to focus on. We call them widely important goals, or WIGs. And if you walk throughout Mackenzie Health and ask any of the staff, what are the three WIGs that you're working on, they can tell you. Because it's really three things that we focus on, no more than three, and everybody can get mobilized around those three objectives. And I'll give you some specifics about those measurable goals and some of the things that we're working on. Lean improvement. We at Mackenzie Health embraced this over almost 3 years ago, and it has really driven a real different view of how we look at our operation. So there used to be a time where we said, well, we need more money, we need more money, we need more money. We've taken the approach that obviously growth does require more funding, but there is waste and efficiencies to be found within our hospital. So a number of years ago, when we had some financial difficulty, we actually were able to find almost $9 million in efficiencies, grow our volumes, and do things better and more efficiently. So that's the lean philosophy, and as an industry, I think healthcare has embraced this over the last number of years. We are really bringing in some of the basic concepts that have existed in manufacturing for many, many years and are now employing it within our organization. So just to give you an example, one of those WIGs that the board holds management accountable for is patient satisfaction. There's a question in this NRC's Picker survey that goes out to probably 1 in 5 patients that are discharged from hospitals all across the province. And the question is, would you definitely recommend your local hospital to a family or a friend? So in this case, it will be Mackenzie Health. And you can see that this number does fluctuate month to month. But overall, over the last 4 or 5 years, our trend line has been very positive. Our goal is to get to a 75% rating, so that would be 75% of patients that are discharged from Mackenzie Health would say, I would definitely recommend this hospital to a family or friend. Now, the number one challenge around patient satisfaction, the biggest concern our patients and our families tell us is communication. So some of the initiatives that we've put in place are there to rectify that. So manager rounding, as you see on the left-hand side, is a manager or a supervisor on that unit rounding on every patient and family every day to ask them how things are going, if there's anything else that can be done, are there any gaps in the treatment, are there any issues around communication. As well, we develop a discharge checklist. So discharge is probably the most trying time for a patient and family because there's the unknown of what's going to happen next when that patient is discharged to either another level of care or home. So this checklist prepares the family well in advance for the things that have to happen. It also ensures that we don't drop any balls at the point of discharge, which is very, very critical. Discharge phone calls. So for high-risk patients, we actually follow up 24 to 48 hours afterwards and make sure everything's done appropriately. If there's any gaps in service, we address it at that point. So these are all things that drive communication and effectively coordinate care, and we believe they're having a very positive impact on patient satisfaction. Another major challenge in healthcare, and this is not unique to Mackenzie Health, this exists across the system, is waits in the ED. And the most significant wait in the ED is for a bed. And that is sort of a multifactorial system issue. The challenge that we all face across the province is a number of our beds are occupied by patients that could be cared for at another level of care. So whether it's a nursing home bed, a rehab bed, a complex care bed, or at home, at any given point, 40 to 50 beds at Mackenzie Health are occupied with these types of patients. Irrespective of that, we still find it an opportunity to do things differently. So what we've done is looked at those patients, but more importantly, looked at our internal processes within the ED and across the organization to reduce the wait for admitted patients. And you can see a downward trend, and we set a target of 38 hours, and we're actually consistently now well below that. In fact, the month of November, we're in probably 27 hours. So we made a major gain, and the biggest change here is for the entire organization to mobilize itself around the fact that an admitted patient in the ED is everybody's problem, is everybody's opportunity. So the whole organization looks at flow and tries to flex itself so that that patient who's waiting in the ED can be moved out as quickly as possible. And one of the things that we did, actually, we introduced a new level of care. We call it our express admission unit. So these are patients that typically have a length of stay of 48 to 72 hours, and we manage those patients more effectively on that unit and enable them to be moved out of ED more effectively. So we've made some real gains. We know we can do better. At other levels of waits for non-admitted patients, we do very well as well. We're one of the top performers in the Central LHIN. Another challenge is our financial resources, and clearly an organization that's faced with the dramatic growth that we are, just to give you a sense, every year we see about 5 to 6% growth in our ED. So that's about 5,000 to 6,000 more visits every single year. And we don't necessarily get a commensurate bed for every single visit, so we have to find ways to do things differently. And we also have to find efficient ways to grow, as I said earlier. But more importantly, we also need to be fiscally responsible. So these two charts demonstrate our financial position. As I said earlier, about 2.5 to 3 years ago, we were looking at a substantial deficit, about $12 million. We've since turned that corner. We are now running surpluses. We're forecasting another surplus at the end of this fiscal year. These are small surpluses, but they demonstrate a real effort on our part to be fiscally responsible. So our cash position on the right is also very solid. We're in a solid place to grow. We need to ensure that our finances are well in hand so that when we grow, we can grow with a solid base. Other achievements, and nursing is probably one of our core services. As you know, nursing represents the largest proportion of our staff, and they provide the most hands-on care of any discipline in our hospital. And we're very fortunate to have received a Best Practice Spotlight organizational designation from the RNAO. And this is driven by some standards that are sort of best practice that we had to demonstrate that we've developed processes, protocols, and policies to be compliant with those best practices. So we're the only hospital in the Central LHIN that's achieved this, and we're very proud of that. We've also been designated by the Central LHIN to be the lead for behavioral services. So again, these are services that we provide in partnership with other agencies, but we're the lead entity, and we're coordinating services across the Central LHIN for that. And we're also in a lead role for stroke care, which is a key service, and you'll hear a little bit more about that from Dr. Strohs as to how significant that program is and how critical it is from a patient care perspective. So this is not a chart that should be a surprise to anybody who lives in Richmond Hill or in Southwest York region. We know that we're faced with substantial population growth, and I think many of us even believe these numbers are underrepresentative of what's really going to happen when we look at the density of growth that's happening in Richmond Hill and in Vaughan. So clearly this demonstrates the fact that no single site or no single hospital can accommodate this much demand for services in Southwest York region. And it's not just about the absolute population growth. When you hear Dr. Viduras talk about our seniors in our chronic disease program, we're seeing probably 30% growth over the next 15 to 20 years in population. When we look at our cohort of seniors and those with chronic disease, the demand on services is going to be upwards of 140%. So we know that we need more services. We need to organize them differently as well. A hospital isn't the answer for everything, and we're doing some of those things, and Dr. Viduras will speak a little bit more about that. So at the end of the day, growing services, expanding services can't be done in isolation. We know that there's a number of partners, and we're fortunate to have both the town of Richmond Hill and the city of Vaughan supporting us, our province through Infrastructure Ontario, as well as the LHIN and the region of York. And now this is more particular to the Vaughan project, where there's support for lands from the city of Vaughan, and there's funding from the region of York for capital infrastructure. But without these partners, obviously nothing is achievable when we look at growing services. So today is an important part about that. Community consultation is something that's core to our business. We are accountable to you, the taxpayers, and we need to ensure that you're engaged and are aware of what's going on. And I think we've made a real effort over the last number of years to be very focused around community engagement. In the past number of years, I think the last 2 years leading up to the brand launch, we've consulted with over 1,200 residents through a variety of forums. Obviously open houses like the one you're at today. We have obviously online tools. I host a President's Advisory Council that actually engages residents from Richmond Hill and Vaughan, as well as service providers, and we get feedback from them around even things as basic as this presentation you're seeing today. They were consulted, they provided advice. Their first comment was, well, it's too jargony, it's too technical, you need to make it relevant to the community. So we find them a valuable resource to help us communicate to you better, but also to be engaged on key issues that the hospital is facing. And obviously our physicians and our volunteers and our foundations members, these are all individuals that are grassroots in the community. We've also, in this survey that you have attached to your program, asked you if you want us to come visit you. We're happy to do that. So we will come out to religious organizations, service groups. Anyone that wants us to come present and share some of our information, we're happy to do that because it's core to our business. Now, as we looked at expanding services, we needed a framework in which to evaluate our decisions and make sure that we're trying to balance decisions. At the end of the day, any decision is difficult. It's challenging because you're trying to find the best solution, and there are compromises that have to be made. But the things that we won't compromise on are things like quality, accessibility, affordability, and flexibility, and as part of today, engagement. So when we talk about quality, quality is driven by many things. It's obviously hiring the best and the brightest staff, but it's also looking at how services are organized and delivered. And there's been a lot of research in the last number of years, probably the last decade or so, that's demonstrated, no surprise, that the more you do of something, the better you're going to get at it. So having critical mass of services for specialized services makes a lot of sense and improves quality outcomes. Accessibility is driven by wait times, but it's also driven by travel times. Affordability is about building programs that are sustainable and that we can ultimately support in the long term. And flexibility looks at our facilities, but also some of the services we provide. So as you look at some of our future models, please keep these dimensions in mind. It's the ethical framework that the board uses in some of their decision making as well. So what are we really excited about? And as I said to you earlier, when we launched the brand and the staff saw the opportunity that is being created by this, the struggle is capacity. We know that day to day we struggle. 5,000 incremental visits every year in the ED is an absolute challenge. And we know we need more beds and we need more hospital capacity. So what does this model of care provide? It provides 70% more capacity for acute care. So this is everything from obstetrical beds, pediatrics, med-surg, mental health beds. 40% more surgical capacity, 50% more critical care capacity. And you can see the balance. I won't read it all out. But the fact is that we are able to grow in a very significant manner. So as we've communicated in previous sessions, about a year ago we shared sort of the concept of core and specialized services. So when we spoke to you about a year ago, we identified the fact that both hospitals will have core services defined by emergency department, surgery, intensive care unit, med-surg beds, and clinical supports, which reflect programs like medical imaging, laboratory, respiratory therapy. So those are core services that will exist at both hospitals. At a regional level, and this now goes to some of those dimensions that I looked at, those pillars that you saw, we will have services specialized in birthing and obstetrics, pediatrics, rehabilitation, mental health services, and continuing care. So those are more regional programs that require a greater critical mass to deliver more depth and more breadth of services. And Dr. Strohs and Dr. Viduris will give you examples and more of a robust explanation when they come up very shortly. And then we have broader regional services. So these are programs where we are going well beyond the catchment area of Southwest York region, where we're designated in many cases by the government as the regional provider. So we are the regional provider for chronic kidney disease. So this looks at everything from pre-dialysis to end-stage renal disease. And we are obviously supporting Markham-Stouffville as well as Southlake in those types of programs. Same thing with district stroke, where we are the center where ambulances will bring stroke patients from across York region. And a new program, again, will be expanded on by Dr. Viduris, that we would like to try to broaden our horizons around is seniors and chronic disease. And this goes back to my earlier point. It's about that 140% growth over the next number of years. We have to find different ways of delivering these services, and we have to find a different model for caring for this patient population. So I'm now going to ask Dr. Strohs. So Dr. Strohs is our medical director of our diagnostic and therapeutic program, and he's going to speak about birthing, pediatrics, and district stroke. And following that, Dr. Viduris will come up and speak about mental health and seniors and chronic disease.
Okay, thanks very much, Altaf. You saw a few slides back the explosive growth that's coming in the York region, and with that is going to be young families coming. So we anticipate over 3,500 births that are going to be taking place in the York region over a short period of time. And with that, we can leverage that growth and take advantage of some of the spin-offs with that. So our plan is to grow the prenatal screening and high-risk pregnancy unit in the York region. So what will that allow us to do is to look after more complex obstetrical patients. Right now, these patients may have to go down to downtown to more specialized areas. At this time, we'd have obstetricians who have an interest in that, as well as internists, so they'll be able to look after patients that have got more complex medical problems and bring a safe delivery to those patients. Not every delivery goes smoothly. We right now have 8 neonatal intensive care unit beds. We plan to double that to 16. So what that will allow us is to get a neonatologist and create a closed NICU. So what that means, only the ones that are highly specialized look after these very complex small children and nurse them and bring them back to health. So instead of having these sick babies whisked away immediately down to sick kids, they'll be able to stay in the York region. We'd have highly specialized neonatologists looking after them. Anytime a child gets sick, they have to come to hospital. It's a stressful situation, not just for the child, but also for the parents. So we're very conscious of the what's needed to relieve the anxiety, firstly of the child, and if the child's anxiety is relieved, certainly the parents will. So similar to what's going on at North York and sick kids, we're planning to create a child life program. So when the child comes either into the emergency department, surgery, inpatient or outpatient clinics, then certainly their anxiety will be markedly relieved. We have a huge advantage now with this new build that we can create much better facilities. On the obstetrical side, the plan is to have single rooms for the families. So there'll be beds not just for the mother, but for any care spouse that can stay over with them. Similarly, for a sick child, there'll be bigger rooms. Again, there'll be single rooms so that the parent can stay over and help look after the child. We already have excellent pediatricians here to look after our emergency department. I also have an interest in asthma, so we're going to also increase services in the GI realm, as also in in kidney disease, so there'll be a one-stop shopping again. No need to send the patients down to North York or downtown to look after their child. We'll be all looked after here in the York region. At Mackenzie Health now, we have 2 minimally invasive surgical suites. The future of medicine and surgery is going to smaller and smaller incisions and doing laparoscopic surgery. This will be leveraged not just currently in the general surgical realm, but also in the gynecological field. Moving on to the district stroke. Why do we care about stroke? Why is that important? Right now, it's the 3rd leading cause of death behind cancer and heart disease. There are over 300,000 Canadians now living with the complications of stroke. So it's a huge impact socially as well as on the economically on the healthcare side. So as Altaf mentioned, we are the district stroke center for the York region. We are the only hospital that can inject a clot-busting drug called TPA. So if somebody comes in the window of a stroke, we can inject this medication intravenously. Hopefully it will break down the clot that's in the brain, either minimize the impact of the stroke, and in some cases completely alleviate the stroke. We have a detailed program that looks after not just the patient who has a stroke, also in the rehabilitation in the hospital and outside. We're also very conscious about managing stroke before it happens, and that's exactly what we want to do. So what does that mean in the future? We're going to leverage our expertise in this area. We're already using best practices and teaching the other hospitals about these best practices for stroke. We're going to continue in the assessment for those patients at risk. People who come in the acute setting will be managed in Vaughan, and then as they get better, they'll be transitioned over to the Richmond Health Center and then back out into the community. So we will continue to be the district stroke center and be the model of excellence for all of the York region. So with that, one last point. I just came back from a big conference in Chicago. So we're very close to finalizing our purchase for our brand new 3 Tesla magnet. That will be closed probably in the next couple of weeks. And with that, we'll be getting much more specialized software. So we can do the techniques called perfusion or diffusion weighted imaging, both on the MR side and on the CT side. So with that, we can inject intravenous contrast. We can see the brain that is either affected with stroke, and also the brain at risk. So this was all critically important for strategizing patients and getting them back to health. So it's very exciting, and in the new year, great things are going to be coming to Mackenzie Health. So with that, I'm going to turn it over to Dr. Viduris, and he'll continue.
Thank you. As was noted, one of my jobs is to be the Medical Director of Seniors and Chronic Disease at Mackenzie Richmond Hill Hospital. My other day job is to be a family physician in a 6-person family practice in Thornhill and Vaughan. And I can tell you that from both of my jobs, using for my patients all of the services in our communities, we have really an excellent medical system for the people of Southwest York region. What I'm really excited about, though, is that as we move forward to the 2-site model and the second hospital, we will really have the opportunity to vault our services into the world-class level. So to give you an example of that, I just wanted to talk about 2 areas of the hospital. The first one is mental health. As it is now, our mental health department is located in a wing that was originally built in 1974. It has been completely remodified up to current standards in the last few years, largely as a result of a family's donation named the Peaks. And we now, I can tell you, have an excellent facility with many good psychiatrists and many great programs, including Child and Family Services, which used to be known as the Shaw Clinic, which is renowned throughout all of Ontario. So although we're able to get good service now, once the new hospital opens, as you can see by this slide, we will have 32 inpatient mental health beds, 26,000 outpatient visits, the ability to take care of 28,000 behavioral service visits, and 4,500 child and family service visits. And even just looking at the inpatients, the new inpatient department will be modeled on ones that have been developed by the Mayo Clinic, and will now have both an intensive care unit where patients who are requiring high levels of acuity can be taken care of, regular units where people who can be taken care of just by regular nursing staff, and also we'll have a lockdown unit where people who are in a mental state who cannot take care of themselves will be placed and can be monitored and can be taken care of in an appropriate way. This is modern, state-of-the-art, not present in many places in Ontario. We will have that ability to do that. In addition to that, if you look on this slide, you'll see that there's a huge number of new clinics that we'll be able to open, many of which we'd like to open now, but we cannot do it because of space constraints or resource constraints. And I'll just concentrate on two of them. The first one being the metabolic monitoring outpatient clinic. For any of you who know patients who have mental illness, you know we now have a huge number of new medicines that can make them in many cases better. Unfortunately, these medicines have got huge side effects, including weight gain, sexual impotence, endocrinological dysfunctions with hormone imbalances, and all of these things take a lot of problems and a lot of difficulty to take care of. We will be able to have clinics where not only we take care of the patient in terms of their psychiatric issues, but we're also able to take care of the other concurrent issues going on in them. So this is the type of clinic that's the way of the future, something that we'll be able to have. The other clinic, which I actually think is one of the most important ones, is the new first episode psychosis clinic. What does that mean in common English? Well, we know that many mentally ill patients have their first break from the reality or their first psychotic break. This usually occurs when they're 18 or 19 years old, often just as they've gone off to university, and parents and family members find it difficult to know why their son or daughter has got some new, wonderful, different personality. They chalk it up to them going to school, drinking too much, all sorts of other things. In reality, what it is it's the first psychotic break. And we know that if we're able to take these people right away, get them into a clinic, and treat them immediately, we have a big chance of making them better faster and making them better for longer periods of time. This is the type of stuff that we want to move forward for. Because we know that, for example, 1% of Ontario's population is schizophrenic. That 1% of the population uses about 20% of the healthcare dollars over the course of their lifetime because they never get better, they constantly need help, and they're constantly ending up in the hospital. To have a clinic like this is going to make a huge difference both in terms of the health of our community and also in the amount of healthcare dollars raised. And if you look at the mental health population, as I do, as one of the most vulnerable members of our society, to be able to take care of these people in a better way is not only better for our families and our friends, but also for our community as a whole. If we move now to seniors and chronic disease, this is another area that's huge. As Altaf has already pointed out, the population is growing greatly. I think the only statistic that I give is for the first time this year, there are more people in Canada who are over 65 years old than there are who are under 15 years old, which is great if you're over 65, but not so great if you're a resident of the government trying to take care of all of these people. That number is growing and growing and growing, and as it is right now, we're able to treat them quite well. We have 3 geriatricians, numerous programs at Mackenzie Health, Richmond Hill Hospital, but unfortunately they're piecemeal and constricted by restraints in terms of space and in terms of resources. By having the new hospital and being able to move some of the services over into the Vaughan Hospital, this will allow us to open up the Richmond Hill Hospital to have a really strong center of excellence in regards to seniors and chronic diseases. As you see from this slide, we'll be able to have 8,300 geriatric outreach team visits, 4,500 nursing visits, 7,200 diabetic clinic visits, and 5,600 cardiac rehab visits. Most importantly, though, for both seniors and chronic diseases, is that it's realized now by the government and by many healthcare providers that 1% of our population, the high needs group as we call them, use close to 35% of healthcare dollars. They're kind of like the frequent flyers in Air Canada, the guys who've done 100,000 miles. They're the people who use a lot of the services. And these are the people that we have to devote our services towards. We will be able to do that with this new clinic. And what we'll be able to do, for example, is take care of congestive heart failure, which takes a lot of effort to deal with, and such things as chronic falls. When I graduated from medical school many, many years ago, it was a given symptom that if a 75-year-old broke their hip and went into the hospital, they had about a 1% chance of exiting the hospital because many of these people died through all the problems that went through it. Now what we've got is we've got many people who are surviving, but they're taking a lot of time to get better. They're putting lots of difficulties on their families and their friends in the community, and it's not their fault. They're surviving, but it's tough for them to deal with it. By developing these falls clinics, we will actually be able to prevent these people from falling. We'll be able to prevent them from ending up in the hospital, and we'll be able to prevent them from having massive surgeries that require months to recover in their frail state. The final thing about our seniors and chronic disease unit is we're also thinking of creating a lightly need inpatient unit. In other words, right now there are many seniors who cannot cope at home and need to come to the hospital to be taken care of. As it is now, we have no ability to put them anywhere except to put them in the general population. And for many of you who've had seniors who've gone into the hospital, you realize that exposes them to infection, all sorts of complications, and they often get much sicker in the hospital than they were before they came in the hospital. And the statistic that unfortunately I like to use is that there are more seniors who die in Ontario hospitals of infection and other complications per year than women who die of breast cancer or men who die of prostate cancer. By having these lightly used units where we're able to take people in, we're going to be able to take care of them, make them better, quicker, get them out, and let them lead a much more productive life. So both on some of the most vulnerable members of society and some of the numerous members of society, I think we're making a huge difference. It's a wonderful thing for a community, and I'm really looking forward to moving forward to achieving that goal.
The Mackenzie Richmond Hill Hospital will focus on seniors and chronic disease, chronic kidney disease, complex care, and rehabilitation. So those are some of the dimensions that Dr. Vidor spoke to when he talked about the seniors and the chronic component of our service delivery model. Mackenzie Vaughan Hospital will focus on stroke, on mental health, on birthing, and on pediatrics. Supported throughout our community will be a number of other services. John Mills spoke earlier about some of our outreach services for autism, behavior management, domestic assault and abuse. These are programs that are not just within the hospital, but are in ambulatory locations and satellites across the region, going as far as Barrie. The thing that we looked at when we looked at this model of service delivery, we need to understand that the 500,000 residents that we're servicing now will be 750,000 in about 10 to 15 years. And to put that into perspective, that's 3/4 the size of the province of Saskatchewan. So what we have in effect is almost a mini little health system. Obviously there's other efforts that have to be made with CCAC and primary care. And you can see Dr. Vidoris is leading the chronic disease and seniors program because of that interface with primary care. But our hope and our expectation is that we can deliver a much greater depth and breadth of service for our community residents within their community, so that they're only going into the city for very specialized services. And that's really the intent of this integrated model and creating these critical masses of service at each of the respective hospital sites. So what does this mean? Obviously the trigger for much of this is the Vaughan Hospital project. And there's been a lot of debate. We hear it quite often. Is this project approved or not? What you have there is a letter from the Minister of Health articulating the approval and a commitment for a tender date for 2014-15. So that's a firm government commitment that requires 2 levels of cabinet approvals, and that's reflected in that letter. So what does that mean? Well, it means that we still have to go through a process. It takes a lot of effort to plan a hospital. This isn't something that happens overnight. We're talking about 1 million square feet of space that's very complex and very sophisticated, and at the end of the day has to be optimal from multiple perspectives, from the patient's perspective, from the family's perspective, from the provider's perspective. And just to put things into perspective, over the life cycle of a hospital, only 5% of the dollars will be capital, 95% will be operating. So anything that we create that's not effective or efficient to run is a legacy cost for many, many years. So where are we in the process? We're currently in stage 2. Our intent is to submit stage 2 proposal to government March of 2013. And then we go through the respective steps. Our tender date, as I said, is 2014-15. Stage 3 is really the stage called output specifications, which actually creates the tender documents that we go to RFP for. And obviously, stage 5 is construction. Now you see 2 stop signs at the bottom. And again, just so that we're clear, July 2011, the minister provided approval, which removed these 2 stop signs. So we don't require further cabinet approvals for this project. We have to go through the prescriptive 5-step process, which requires approvals to go to the next stage by the level of an ADM, but cabinet approval has already been achieved, which means that dollars have been appropriated for future years for this project. So what does it take to plan? Well, it takes a lot of input from our staff and from our community. So we have a number of user groups that are actively working in stage 2 planning, 39 user groups that are divided by functional area. So there'd be a user group for the emergency department. There'd be a user group for the intensive care unit, for diagnostic imaging. So these user groups are meeting frequently. They've probably spent upwards of, probably individually, I'd say at least 30 hours each. So imagine 400 people times 30 hours. It's a lot of effort of staff and community members in the planning for this facility. Some of the things that they're talking about is how do we deliver services? And the great thing about healthcare, and in particular our organization, we've evolved not to just think about what's important for the provider, but what's important to the patient and the families. So it's dimensions of how do we ensure that we're meeting all of our stakeholders' needs? What programs will be delivered? How will they be organized in terms of space and adjacency? So an example would be the relationship that exists between an emergency department and a medical imaging department. I think universally, any hospital you go to, those two departments are next to each other because there's a key relationship, which is 50% of patients that come to the ED usually require some kind of medical imaging intervention. So if you put it at the other end of the hospital, that would be a very inefficient way to design your facility going forward. So those are the types of discussions, and the problem is everybody wants to be next to Dr. Stroh's department, so they're fighting over him. He likes that. We also talk about what's the best built form for support services, and more importantly, how do we ensure flexibility? As best as we can predict what care will be like in 2018-19, we know that healthcare changes very quickly. Dr. Stroh's wants a 3T magnet. I don't know when he'll want a 6T magnet. So we have to build in that flexibility into space to ensure that whatever is happening, as best as we can, we're going to future-proof this hospital so that the design is flexible. So those are some of the things that are being discussed as we sort of are into stage 2 planning, and a lot of effort on staff's part. And remember, as much as they're focused on looking into the future, they also have day jobs where they're actually providing day-to-day clinical services. So I think our staff should be commended. They did most of this during the summer months, so people put holidays on hold so that we can meet our deadlines and achieve some of the targets for functional programming. So community support is essential. That's why we're here today, and obviously we're going to continue our dialogue with you. But we do have a lot of support from other levels of government. So what's important, and we're very fortunate in York Region to have the support of the region of York through what is defined as an infrastructure grant that's provided to all hospitals in York Region. And the commitment is $117 million towards the Vaughan Hospital and $35 million towards the Mackenzie Richmond Hill Hospital. So we're fortunate because that puts less burden on local share and enables projects like the Vaughan one to proceed, because local share is a key factor in government's consideration of projects. We have land contribution from the city of Vaughan, so if you're not familiar, there's 82 acres north of Wonderland, and a portion of that will be provided for the hospital's use to build the Mackenzie Vaughan Hospital. Strong donor support from the Mackenzie Health Foundation. A number of foundation board members are here. You can see their commitment as well. They're volunteers, and they know how important community engagement is, and obviously under the leadership of Fraser Nelson, who's the chair of the foundation. What's also important to our organization is we have representation from our elected representatives. So Mayor Dave Barrow sits on our board, as does Mayor Bevilacqua, as does Chairman Fish. So that provides key inputs into our process and into our interface with other levels of government as they continue to provide us with support. So a little plug for the Mackenzie Health Foundation and how important local share fundraising is. As you know, government, and Reza, this is not in any way offending you, I hope, but the challenge we face is the provincial government does support capital infrastructure, but equipment is something that we require support from local foundations for. So ongoing support of the Mackenzie Richmond Hill site through the need for equipment. There's a $50 million campaign that's focused on that over the next number of years. And also for the Mackenzie Vaughan Hospital, which will be a local share in the ballpark of $300 million. if we look at $1 billion price tag for a hospital. Again, that's high-level numbers, very premature at this point, but we're giving you ballparks. And obviously, some of that support is provided through the $117 million from the region and other sources. So as you can imagine, there will be a significant campaign for the Vaughan project as well. Now, the Mackenzie Health Foundation has a strong history of fundraising. Founded in 1977, they've raised over $66 million to date. So this is something they're good at. They have relationships, strong board, and obviously we're looking for continued support for both hospitals. What's also important is as much as healthcare is local, we want to ensure that that's maintained. So people can make donations specifically to a program, to a service, or a location. In this case, they can make donations specifically to the Mackenzie Richmond Hill Hospital or the Mackenzie Vaughan Hospital. So those structures are in place, and those funds can be segregated to ensure that donors' wishes can be met. So I think I've spoken to this a little bit in terms of the ballpark of the campaigns. $150 million for the Mackenzie Vaughan Hospital, and $50 million for the Mackenzie Richmond Hill Hospital. Again, these are critical requirements as we go forward and continue to seek community support as we ensure that we have the best tools and the right tools. These tools are important, as I've said, I think most recently at the town of Richmond Hill, to attract the best and the brightest. Equipment is a key attractor. So to provide those tools and the best services, we need the best equipment and the best facilities, and obviously supporting our foundation is core to that. So we ask you to continue to be involved. We thank all of you for coming today. I know that this is your personal time, and I'm sure there's other things that you can be doing, so we are very thankful that you took the time to come and listen to us today. We have other vehicles like the President's Community Advisory Council. We will continue to do community consultations. In your agenda, there is a form, an evaluation form that we ask you to fill out, but there's also, if you would like, a request where we will come to you and give you some of the information you're seeing today or have other information presented to you. And obviously we have patient and family advisory councils. Those are very important, especially as we look at planning some of the Vaughan facilities so that patients and families' input can be sought to ensure that we're finding the right balance between what the providers want, what the administrators want, but also what is core, what the patients and what the families want. So I think we're going to now open it up for questions. The other key piece in terms of staying involved is our volunteers. They are a vital resource and they are core to our business. Without them, the hospital would not function. And they're always looking for recruits, so please get involved. They have a board as well that's actively engaged in some of the key priorities of the hospital, including fundraising. They've pledged a significant amount of dollars towards the MRI as an example. So there's other ways that you can get involved, such as the volunteers, either volunteering your time at the hospital or supporting in fundraising.